The most foul patient encounter you've had with someone ignoring their own health. The maggot cast. We had a patient come in with a leg cast he hadn't removed in nearly 6 months. He said he felt a little tickle. When we finally sawed it off, the smell hit us before the visual did. The entire space between his skin and the plaster was a thriving, writhing ecosystem of maggots. The worst part, they had actually done such a good job eating the necrotic tissue that they likely saved him from sepsis. He looked down and just said, "Oh, I wondered why it felt heavy." A patient had such severe gangrenous necrosis in both legs below the knee. She had been crawling around her apartment. The smell permeated the whole unit. I had a nursing student with me to change the dressings. Doused a mask with peppermint oil and put another mask over the top. I was legit afraid that her leg would just come off in my hands while changing the dressing. She was so afraid of surgery that it still took several days to convince her it was necessary. A very nice couple came in from a rural area for the wife to have a short elective procedure. The smell of them combined was enough to clear out our unit. Everyone was throwing on masks. They were from the middle of nowhere where, and I think they must not have had, or at least regularly used, running water. They smelled like a giant, moist, yeasty, bacteria-infested groin. We had to have the curtains changed after they left because the smell was lingering. A majority of my medical career was spent working in plastic surgery at a level 1 trauma center. I've seen lots of WTF cases and everyone keeps mentioning maggots, so here's my maggot story. We had a homeless patient that came to the ED for chest pain and had literally 10 layers of socks on. When the socks were removed, all of his metatarsal bones were fully exposed, no flesh. He didn't even realize his foot was basically all bones because he had went years without taking off his socks. It probably started as a diabetic ulcer, but the maggots did their job plus some. Gentleman had a cut on his leg and went swimming in a polluted lake. He ignored the infection to the point where he was either gonna lose his leg or his life. Surgeons did multiple amputations, first at the ankle and then at the knee. It was gnarly. Matted hair with severe lice infestation that I had to cut out, maggots and new amputation, patient discharged to nursing home came back in as readmit, wax buildup in ears so thick other nurses were documenting hearing aids, loads of patients coming in that were neglected with feces caked and dried in every crevice of their body, necrotic toes that the patient proceeded to pull off and hand to me, 12-inch long fingernails that were curled up and dusty. The list is truly never-ending when you work bedside. Another maggot story from the ER. Former prominent lawyer, raging alcoholic, wheelchair-bound, incontinent, and homeless, was found freezing on the streets. For footwear he wore rubber rain boots with socks. Paramedics brought him in where we discovered he was urinating into his boots, socks were decomposing, and the tissue on his feet was decomposing to the point you could see the ligaments and tendons in his feet as well, scores of maggots. He went to surgery, lost half of both feet and was recovering in a room. Went up to the floor where he was 4 days later and there were no-pest strips hanging everywhere. They had a serious fly problem up there from the flies crawling out from under his bandages. The frail dementia patient that was being physically abused and raped by her caregiver, husband. That was the worst for me. Guy came into the ER with an abscess on his forearm about the size of a golf ball. Needle marks on both arms. He asked me, "How did this happen?" I thought he was joking. With a chuckle, I said, "How do you think?" He said, "I don't know, that's why I'm asking." Well, when you stick yourself with dirty needles. A homeless man came in complaining that his foot has been hurting for some time. He was wearing some really old work boots and said he hasn't taken them off in over a year. Took off the boot and a toe fell out. The smell almost cleared the room. Called out for weakness and wife tells us that he had been crawling around for a day or two, older couple where the husband has the final say dynamic. Wife is telling me about a spot in 2002 while my partner was assessing the husband, and I was trying to redirect the conversation to events happening now. Walk into the bathroom where he's sitting on the toilet, and turns to look at me, and that spot from 2002 was now necrotizing half his head. Corner of the eye to the back of his head was untreated skin cancer. Ear was gone, which ironically his only complaint was that ear itched. They had been covering it up with a beanie-style hat when he would go out, and he just refused to go to the doctor for the whole 50 years they had known each other. Home health nurse here. Had a patient with a severe pressure wound to their heel. Took the bandage off to change during a visit and their live roaches scattering out of the gauze wrap. She was 100 alert and completely unaware. Sadly they lived in low-income housing apartments and the whole building was infested. Retired respiratory tech here. Grossest thing I've ever seen is a patient who cleaned out their trach tube by inserting one end into his mouth and then sucked the mucus out. I was both impressed and horrified. Dude was a Vietnam vet who's definitely been through some shit. I really should have stopped reading after the first story. Swamps of Dagoba. IYKYK. I had a patient that was 300 to 400 pounds, we were moving them into a bed because they couldn't walk and cigarette butts kept falling out of their fat rolls. Relayed to me by a friend, elderly frequent flyer comes in last summer and for some reason or another a hospital staff member is sent to retrieve something from her RV, staff member gets to the RV, opens the door and is swarmed with flies. When those dissipate, they see a mummified corpse. Turns out her husband had died a while ago of natural causes and she'd been living in the RV with the remains for who knows how long. Apparently she did not think it necessary to warn the staff member she was sending to the vehicle when she handed over the keys. When asked she said something about not knowing what to do with the body when he died so she just left it. I work in the lab. One time we received a gangrenous toe with a fresh coat of pink nail polish. It shook me because someone had just painted it, then you go to the doctor for your black dead toe. But at least they got medical care,